Hi, this is Rafay Sabzwari. I'm the second year cardiology fellow at Lehigh Valley Health Network, and I have the pleasure with me of having Dr. Apurva Vyas. He's the associate program director for the cardiology fellowship, as well as a prominent non-invasive cardiologist at the network. Good to have you, Dr. Vyas, over here.
Thank you. Good to be here.
I would like to begin by asking you, like with the ACC, and especially you were involved so much in the critical case setting and seeing all the new mechanical circulatory support of what are the new features that you felt that has been brought up at ACC, and for the fellows that are actively managing patients in the CICU that we have of help to them.
Yeah, that's a good question. So one of the underlying themes, I think, in critical care cardiology over the last few years has really been that the transition from being a coronary care unit where we're dealing with STEMIs or coronary related issues to really being a cardiogenic shock unit. And it's not only that it's cardiogenic shock, but the shock can come in various shapes and flavors, and being able to have all of the tools to be able to deal with that is going to be an important transition in terms of how we train as well as how we take care of patients.
Well, thank you. And on the same thing, I know you're involved in vascular medicine and all, and that's a growing and emerging field, and we see a lot of a place that more cardiologists are trying to find a home for. So in terms of FITs who are trying to get involved in it, and as a career option, what would your recommendations be to them?
Yeah. So I think, RPVI training, registered physician in vascular interpretation is a good strategy. It allows us an opportunity to get involved in vascular imaging, and because it's ultrasound imaging, hopefully some of the ultrasound basics are some of the things that we've learned via echo training as well. I think aligning yourselves with either vascular surgeons at the institution or those interventionalists or non-invasive cardiologists that are interested in vascular medicine or do peripheral vascular interventions is also a good opportunity to learn sort of how they think, what are the things that they're looking for, when do we decide this is something that we can treat via medicine versus PCI versus a surgical intervention. And I think, kind of gaining their experience and looking at how they treat patients is a good opportunity to learn how to go about with your vascular training. Physical exam becomes very important, and I think a lot of times, even with clinic patients that you may see in the office, there's many times where we don't take their shoes off or we don't, look at their legs and feel pulses. And a lot of times those are really quick and easy screening tools that you can utilize to kind of screen and say which patients do I really need to do additional testing on and which patients I can probably get by. So I think the history and physical is where it starts, but having an opportunity to, focus on the vascular part of the cardiovascular training is important as well.
I think that's an important point, especially that the fact that we are all called cardiovascular fellows lays the emphasis on that too. And lastly, Dr. Vyas, I would like to pose the question. So you've been a FIT just recently, and now you've been an associate program director. So just for the FITs in general, how to get the most out of the ACC and how to get more involved in their careers as well?
Well, I think the ACC app is great. I think because the conference is so big and there's so many people, I know as the first time I was coming as a FIT, it was just so overwhelming that, a lot of times there's inertia because you don't know where to go because there's so many places to go. So I think having an opportunity to download the app, even to this day, is something that I do, and using the ACC app to sort of map out, these are the things that I want to attend, these are the things that I may be able to, get from other sources or from the JACC journals later on. I think having that sort of strategy is a good way to go.
Thank you so much, Dr. Vyas, for being with us. And for more on this, please visit youtube.com/fitsonthego.